All right. I first would like to thank everyone for attending the webinar and for Professor Randall for giving me this wonderful opportunity to talk about, I think, a very, very important and exciting area of research on the social determinants of health disparities. This is a new area of research, and we are moving quickly in terms of understanding some of the foundations and underpinnings of health disparities in the United States and beyond. I first want to give you an overview of the presentation. There are two main goals. First, to examine existing theory and research findings regarding the impact of racial inequality on health outcomes in Black Americans. And secondly, to present a conceptual model of the potential and specific effects of racial inequality as a chronic stressor and risk factor for poor health in Black Americans. I'd like to start first with some definitions of the terms that we're going to be using throughout the presentation. Racial inequality is a form of social inequality, where specific racial and/or ethnic groups have unequal social status and/or unequal access to societal resources relative to other groups in a society. Racial inequality, it's important to keep in mind, is the result of legal and non-legal systems of discrimination. So it is the legal and non-legal systems of discrimination that form the foundations of health disparities in our country. Legal and non-legal systems of discrimination result and impact health disparities because they form the foundations for dominant and secondary social groups in a society. In turn, these dominant and secondary social groups differ in the levels of power that they have in the society, including political, legal, economic, social, and personal power. Secondly, dominant and secondary social groups differ in access to goods and services in the society, such as medical care and services. And thirdly, dominant and secondary social groups differ in the levels of chronic and acute stress, in particular poverty, violence, and other stressors that are associated with secondary social status. So, existing research strongly suggests that racial inequality may include experiences of racial discrimination, and that these experiences of racial discrimination occur at the personal or individual level as well as at the institutional, for example, legal levels of the society. As Professor Randall mentioned in the statistics that she presented on health disparities in the United States, it is generally racial discrimination at the institutional level that is the primary cause of disparities in health among racial and ethnic groups in the United States, especially Black Americans, given our history in the United States. Racial discrimination at the institutional level impacts health and other outcomes because it's been codified in a society's institutions, customs, and laws. Therefore, the impact of racial discrimination at the institutional level is greatest when discrimination is legalized, such as what we've seen in the United States and in South Africa during the era of apartheid. Exposure to legal racial discrimination is consistently related to poor health outcomes in the United States and abroad. This has been shown across the world, regardless of the society that is the point of focus. Consistently, when you see examples of legal racial discrimination, you will see poor health outcomes in the specific groups that are the target of that legalized oppression and discrimination. This point was made clear by Jonathan Mann, who was a humanitarian physician and researcher at Harvard Medical School, in looking, for example, at AIDS health disparities, where he found in many countries that it was the interface between the lack of legal rights on the part of the oppressed women in this particular example that were associated with their higher risk of exposure to HIV. The inequalities associated with racial discrimination at the institutional level, i.e. those inequalities in income, housing, education, and medical care, are indeed among the most important risk factors for health disparities. So consequently, in the next section, given this context or foundation for social inequality and racial inequality that I've shared, we'll explore how social equalities, specifically racial inequalities, specifically influence health outcomes in Black Americans and other racial and ethnic groups in the United States. So we'll be looking at the mechanisms by which racial inequalities influence health outcomes. So at this point, I will take a short break. I will answer questions, and we'll move on